Hello everybody, Illece Buckley Weber, Mayor of the City of Agoura Hills with you again today for a little bit of an update. As of yesterday, the number of confirmed cases in Agoura Hills is still 31. And as many of you know, Trader Joe's in Agoura Hills closed this past Saturday because one of their employees tested positive for COVID-19. They have reopened, but in the meantime, they did undergo a level 1 cleaning of the store. But we still want to ask you, please wear face coverings and practice physical distancing in all of our essential businesses. We need the workers to stay well so the businesses can stay open. We don't have any other information to provide about the employee that was tested positive for COVID-19. The privacy rights of individuals are very strong in this country, and we appreciate that, so that's all the information that we have. But Trader Joe's has told us you should feel safe to come into their store again because they've gone through the level 1 cleaning. We also have 1 resident and 4 employees at Meadowbrook Assisted Living Facility who have now tested positive for COVID-19. We have no other information at this time, but the county has been notified and they have assigned a caseworker to it. Earlier this week, Governor Newsom announced that he will begin lifting restrictions on the state's Safer at Home order. He intends to give more information this Thursday. To complicate things, however, California counties are entitled to continue their restrictions beyond the states as they deem fit. The City of Agoura Hills is bound by Los Angeles County public health orders. What we know today is that the County of LA is maintaining its stay-at-home order until May 15th. We hope to know more within the next week. What this means is if the restrictions lifted by the governor conflict with LA County's order, the county order governs our actions. So please follow the actions of the County of Los Angeles. As soon as we have the information from the governor and the county, the city will dissect it and provide all of the information to you. We ask for your patience because we want to be absolutely sure that the information we give you is accurate. So hang in there with us. Now, today, I have a special guest. I would like to introduce you to Dr. Catherine Ferguson, an Agoura Hills resident who has been a medical doctor in Ventura County emergency room since approximately 2014 and has spent her professional career practicing emergency medicine. She had obtained her BA from Duke University and her medical degree from Eastern Virginia Medical School. She and her husband moved to Agoura in 2017, have become very involved in our community, and are expecting their first child in June. So, welcome, Dr. Ferguson.
Thank you.
People ask whether the stay-at-home public health order has helped our medical professionals. As a local physician, do you think it's helped the medical facilities in our region?
I specifically want to thank everyone for staying with the stay-at-home order. Everyone I know in the medical profession is very grateful. It's given us time to plan and prepare and gather resources. When COVID starts to grow, it grows exponentially. So if we hadn't really gone into a very strict shelter in place when we did, we could have been overwhelmed quickly without the ability to treat people as well as we would like. So we're very grateful that we've had this time to put in place those plans, and we'd like to thank everyone for not only keeping the cases down, but also that helps to protect us healthcare workers.
Are our local hospitals properly equipped to handle the COVID-19 crisis?
Yes, I do want to reassure everyone that all of the hospitals in our area have done extensive planning to make sure that we are prepared to treat COVID patients. That's required gathering supplies, doing extensive meetings for the last few weeks to months to make sure that we're ready to treat those patients. And I want everyone to feel comfortable that if they have COVID, that we are ready to treat them.
How about face shields, ventilators, PPE? Do you have what you need?
Yes, we are doing all of our best efforts to conserve all of the personal protective equipment that we have and to make good use of them. I know that my specific hospital has been very grateful that a local donor donated face shields that we've been using for our COVID patients. So right now, I think that we're always identifying new things that we need, like swabs or reagents, but we have all the equipment that we need right now.
How about non-COVID-19 cases? Are the hospitals equipped to handle those patients as well?
Yes, that is one message that we really want locals to hear, is that the emergency department is open 24 hours a day, 7 days a week, 365 days a year for everyone if they have an emergency. We have been worried that people are putting off coming to the emergency department for other serious emergencies like heart attacks and strokes and appendicitis. And we want you to know that we're still here for you and that we hope that you come in if you're having an emergency. We don't want you to put off care, and that we've taken a lot of effort to make sure that patients are safe and that COVID patients are treated separately from all of the other patients.
Now, locally, do most of the COVID-19 cases, are they coming from nursing homes?
So on the Los Angeles County Public Health website, they publish every day which care homes in the area are affected. Nursing homes are always part of the cases. They don't make up all of the cases or even a majority of the cases. But any communal living environment, such as nursing homes or dormitories or prisons, that's always going to be a very difficult place to control a virus and an outbreak. So those are going to continue to be places where we see cases and where we have trouble controlling the spread. Now, the hospitals in Ventura County have agreed to admit all COVID positive patients from nursing homes to the hospital to protect those nursing home residents from being infected. And that is a challenging thing for hospitals to do, but we do feel like we want to take that on in order to protect the other patients that live in that facility.
That's great. The stay-at-home order, we know that it's helped with the medical professions get prepared, but do you think it's kept the number of confirmed cases down?
I think everyone in the medical profession thinks that it has kept the cases down. When we talk to our emergency medicine colleagues in New York or New Jersey or Detroit, we feel very grateful that we practice here and that we have been able to keep our caseloads down. So as I said before, we're very, very grateful that everyone has tried to keep to the stay-at-home orders because it has helped us to manage the cases that we have.
Now, we've heard a lot about ventilators since COVID-19 hit the state. What's the treatment provided to patients before they go on a ventilator?
Sure. So there are lots of different treatments that we offer patients. I think there are different ways of delivering oxygen. The biggest problem that most COVID patients have is maintaining their oxygen levels. So we have different ways of delivering oxygen. There's also a lot of times we put patients on their stomach, which helps them oxygenate a little bit better, at least for part of the day. There are multiple medication trials that patients are enrolled in if they meet the criteria or they seem to be the right patient for it. The most common ones are hydroxychloroquine with azithromycin, remdesivir, which has been in the papers recently, Actemra, convalescent plasma. Nationally, there are over 127 therapeutics, was the last that I saw, that are being tested at different levels to see if they're effective against COVID.
That's good to hear. Part of the county public order is social distancing, and that's keeping physically away from some other people, more than 6 feet away. Do you think that that has helped?
I definitely think that social distancing has helped. I think since ancient times, as long as medicine has been practiced, we've known that when there is an outbreak of a disease, that social distancing is the best prevention. I think that that has helped keep our cases down. And going forward, as many other physicians have said, this is just the beginning of a long course of COVID, that we're going to be dealing with this virus for a while, and that we're going to have to continue to find ways to socially distance while also finding a level that we can maintain.
A little controversial across the country, but what about face coverings? Do you feel that face coverings help prevent the spread of COVID-19?
I can say that I personally wear a face covering in public. I have this adorable one. But I definitely think anytime when you're going to be within 6 feet of another person that it does help prevent spread. We know that the 2 days before patients show symptoms, so when they're still what we call asymptomatic, that they're still very contagious. And a lot of times you don't know if you're a carrier of COVID-19, and it's important to wear a mask to prevent other people, but it also helps prevent transmission in the community.
Now, hand washing. We know that hand washing with soap and water kills the virus. As a doctor, can you show us how you wash your hands?
Sure. And there are many videos on YouTube that show this a little bit better. Surgeons are always the best hand washers. But the way that I wash my hands, just 20 seconds is what's recommended. So you turn on the faucet. You always want to use antibacterial soap. Usually you start cleaning one hand, including all the fingers down to the elbow. And then we change to the other hand. We clean each individual finger in between the fingers down to the elbow. And then you rinse once through water, each arm, with your hands up. And then we dry with a towel. So you use the clean end of the towel to dry one arm. And then you go to the other end of the towel, which is clean, dry the other arm. And then you turn off the faucet with the towel.
Good to know. A number of us probably.
I was going to say, I have heard people do this, but you can sing the happy birthday song for each arm, which works out to 20 seconds. And I timed it with a timer at home, and it is 20 seconds if you sing it twice.
Hand sanitizer. In choosing a hand sanitizer, is there anything that you recommend?
I think any hand sanitizer that's 60 to 95% alcohol is effective. That's what the CDC and the WHO recommend. Anything below that is not going to completely kill the virus. So it's important to use something where you can look on the back and see the actual percentage.
What about antibody testing? We're hearing a lot about that right now. Can you explain what that is and why it's important?
So antibody testing is a very hot topic right now. I would say right now there are only a few tests that are approved by the FDA, mainly under emergency use authorizations. I know that the Abbott test, which is the one that Quest uses, is available. You can take it without a doctor's order. You order it through their website. And then LabCorp also has one that requires a physician's order. As a physician, I would strongly recommend talking to your physician about whether or not you really need an antibody test. Most people are just curious if they had coronavirus. The most important thing that we want to say as physicians, is that having a positive antibody test right now, based on the science that we have, does not mean that you are immune to coronavirus. It's not an immunity passport. We don't know the levels of antibody that you need in order to be immune, or even how long that immunity lasts. For some other coronaviruses, that immunity only lasts a year. So there's still a lot of studies that need to be done. I know that the Abbott test, you can look at the sensitivity and specificity. So sensitive means how many of the cases does it capture. That's pretty good. So false negatives are very rare. But with false positives, even with the specificity of 99.5%, you're still going to have about a 16% false positive rate in a community where the prevalence is low. So, there are going to be people that get positive tests back who may not have truly had coronavirus. The one use that it may have that we've been talking about is for plasma donation. So with the Ventura County Medical Association, we really, really want to encourage people that have had a positive COVID PCR test to donate plasma. So if you have tested positive for COVID, you can go to conquercovidtogether.com, and that's where you can look into donating plasma. And that is a treatment that we use for patients that have COVID in the hospital right now. Now, if you have a positive antibody test, you can also donate plasma, but a lot of times that's going to need to be verified again.
Now, you probably know of some personal stories of people getting sick and getting better. Have you seen quite a bit of that as well? We're hearing on the news a lot about the number of cases and the number of deaths, unfortunately. Have you seen people get well?
Of course. And what we want people to remember is that although COVID is a very serious illness, most people that get COVID-19 will recover. So I can think of friends and other physicians that I know that have had COVID-19 who have recovered. And we want people to know that there are many, many patients out there who are recovering.
Now, you're about 8 months pregnant, expecting your first child. Congratulations. What is the research showing about pregnancy and births during COVID-19?
So that's a good question. I think, like most physicians, we always want to be cautious. We've only known about this virus since December, and so we've only had a few months of research. But the largest study that was published in the American Journal of Obstetrics and Gynecology of 43 patients showed that pregnant women have about the same outcomes as non-pregnant patients. So about 15% required hospitalization and about 5% required critical care. Now, every day we're getting more studies about how pregnant women do and about how those babies do. So even tomorrow there may be a study that changes the results. I know that the University of California, San Francisco, has a very large study called the Priority Study. It's over 500 patients that they're collecting data from.
Well, I look forward to hearing more about that. What can we do as a community, other than social distancing and wearing face coverings, to help our healthcare workers?
So I know it is frustrating, but honestly, the very best thing that you can do is continue to practice social distancing, wearing face covers, and making sure that you're continuing to take precautions. I think we also talked about when it becomes flu season to get your flu vaccine, and if you're over 65 or you have other risk factors, to talk to your primary care doctor about the pneumonia vaccine.
Thank you. I was going to ask you, what are we going to do when flu season comes? But what I hear you saying is that you're encouraging everybody to get a flu shot this season. What would you tell young people who may want to have a career in the healthcare field, who are watching and reading about the burden and toll on the healthcare workers?
I would say this is definitely a challenge unlike any we have ever faced in medicine. I know I've talked to doctors who have been practicing for 50 years who say that they've really never seen anything exactly like this. But I also want to reassure people who are interested in medicine that this is a very exciting time to be in medicine. We are learning so much about this new disease. We're learning more every day, and I hope that there are lots of budding physicians and scientists out there who get interested in studying and researching the treatments that we're going to need in the future.
I hope so as well. Now, some of the stay-at-home restrictions may be lifted within the next few weeks. What recommendations do you have for us going forward?
I would say that we still need to maintain the things that we know that work, which is social distancing, trying to wear a mask when you're in public around other people, and also trying to work from home when you can, the things that we know have been keeping the counts down.
Do you have any tips for our residents of things that they can do to take care of themselves?
Well, I noticed having my first telemedicine visit with my doctor that I did need a pulse oximeter at home. If you are able to buy one of those, they are pretty affordable on Amazon. And if you get coronavirus, it does help us treat you. So I think it is useful to have a pulse oximeter and a thermometer and even a blood pressure cuff at home. And that will help your doctor manage you if they have to remotely. I think they're very useful in this situation, and we're especially finding patients with coronavirus. We used to tell them, well, come into the hospital when you feel short of breath. Well, we're finding out that a lot of them don't feel short of breath, but their oxygen levels are really low, and that's dangerous. So we are trying to encourage people to keep one at home.
Now, do you have any reading suggestions for our viewers that might want to read more about this?
I do. I was just talking to someone the other day about my own experience. When I was in college, I actually went to South Africa during the AIDS crisis, and that really influenced my decision to go into medicine. And I hope that there are a lot of other future physicians out there who are learning from this pandemic and preparing to study the things that we need in the future. I know that I've really enjoyed reading a book called The Great Mortality, which is about the Black Plague. There's another book called The Great Influenza, which is about the 1918 pandemic. I've enjoyed reading the beginning of the Decameron, which is it's a collection of stories that takes place during the plague. And then one of my favorite books is How to Survive a Plague, which is about HIV and the AIDS epidemic. And all of those I found very inspirational and full of lessons that we can still use during this time.
I know we all have some time now to do some reading. What about for people who like to watch or watch something on their computer rather than read a book? Do you have any watch recommendations?
I do. Most of them are also about the AIDS epidemic and HIV. I really enjoy a documentary called We Were Here. There's also a video documentary version of How to Survive a Plague. And then there are 2 narrative films called The Normal Heart and another one called Beats Per Minute, which are really about ACT UP and how advocating for patients during that time helped develop the treatments that we have today.
Well, I want to thank you so much for joining us, Dr. Ferguson, today and informing our residents about what's going on more locally and hearing from a local resident. I think they're probably tired of hearing me say the words, stay the course, stay at home, distance yourself, and wear your face coverings, and most importantly, follow the county's public health orders. So it's nice to hear it from somebody else. With that, thank you again, everybody, and we hope you've enjoyed hearing from Dr. Ferguson today. Thank you.